Gracias.
Thank you very much, Maria José Fuster, Executive Director of CECIDA, for your kind and inspirational words. Just like you. That's who you are. And thank you very much for everything you have done and still do. We're now going to continue with our works and move on to session 1, which is entitled Addressing HIV-related Stigma and Discrimination in Healthcare Settings. The chairs of this first session are going to be Dr. Jorge del Diego, Director General of Public Health and Pharmaceutical Development in Andalusia, and Dr. Viatcheslav Grankov from WHO Europe. So without further ado, I would like to give them the floor. We're going to continue talking about stigma.
Thank you very much. Dear colleagues, dear friends, we are starting a very important session, and it's not surprising probably for any of you that this session is one of the first sessions dedicated to the stigma in healthcare settings. It is especially important for our region, WHO European region, as majority of HIV-related services, including prevention, treatment, testing, are still very much medicalized, while community organizations and civil society organizations, NGOs, are suffering sometimes from many limitations in our region, especially in eastern part of our region. So addressing HIV-related stigma in healthcare setting will help us crucially to increase access to prevention, testing and treatment, and change these statistics that we've been seeing. Unfortunately, we've seen from Andrea's presentation today that it's still very high level of stigma in healthcare setting across our region. And this session will be dedicated to addressing this very important problem.
Muchas gracias.
Thank you very much. Good morning to everyone. My name is Jorge del Diego. I'm the Director General of Public Health and Pharmaceutical Development in the Andalusian Regional Government. And from public health, working in the field of HIV and AIDS is absolutely key. It was mentioned previously that stigma is a public health problem. And indeed, it is a public health problem. It's an element that is tremendously important. And it is important, in fact, that we're going to talk about this because we have experts that are going to talk about these essential factors, and I'm going to be very brief to give them as much time as possible. And I'm going to tell you something that's short and sweet. This year, as you know, we have the examinations for access to medical specialities that has to be taken by all doctors in Spain and physicians in Spain when they're going to start in the national healthcare system in any region whatsoever. And one of the questions that was clearly asked in the test was whether they knew that HIV wasn't detectable and non-transmissible, non-communicable. So it would be interesting to know how many people answered correctly the question and how many people actually knew the right answer, because that would also allow us to know how much more we have yet to do in the healthcare scenario, which I believe requires a lot of hard work to be done, and to know what our residents are learning about the patient-physician relationship, and to learn about the stigma in not only stigmatizing diseases like HIV, but what is being taught at universities, particularly in the healthcare industry and sector, to know whether we are actually preparing our future physicians so that they know that the stigma surrounding diseases like these should disappear. And without further ado, I'm going to introduce you to Dr. Esteban Martínez, a clinician and ex-president of CECIDA and currently president of the European AIDS Society, somebody who's extremely well known in the field of HIV/AIDS and whom I does not require further presentation to me. Thank you.
Gracias.
Thank you very much. I'd like to say that for me it's a pleasure to be here today representing the EACS as well as everybody who's part and parcel of the European AIDS Clinical Society and operating in the field of HIV. And I would also like to thank the CDC for the collaboration and all the help that we've received to launch a questionnaire targeted to healthcare professionals of all countries in the European region and WHO Euro. For those of you who don't know what the EACS is, it is the European AIDS Clinical Society. It is based mainly in Europe, but its tentacles go beyond it, and it's an organization that focuses mainly on promoting research, education, and clinical management of HIV infection. Hence, it is a key organization to carry out this task, as well as in the relationship, which has to do with the care, health care, and the treatment of persons with HIV, and to remove stigma and discrimination. At the roots of the EACS, we find the following principle, which is that of non-discrimination. It is part of it since its foundation, and it has been updated with time. In fact, we have made it present in different situations, such as the Ukraine war, with a statement of non-discrimination, and in the statement of the invasion against the invasion of Russia in this country, as well as in any other statements that are AIDS and HIV related. So the knowledge as well as empowerment vis-a-vis HIV and AIDS is key. One of the activities we have carried out is the European AIDS Conference that is held every 2 years. This year is going to take in approximately a month's time at Warsaw in Poland. A series of sessions are going to focus on stigma. This is actually one of them. And as you can see, there are quite a few speakers who are going to talk about it from different scenarios, and one of them is stigma in the healthcare sector. How could we have a better long-term relationship with the CDC? Well, we started with a questionnaire targeted to the community. We all have already the results obtained. That was the first step we took. But secondly, we wanted to know what would be the situation of stigma in the healthcare setting. And with the collaboration that we forged with the CDC at the EACS, we've had the fortunate possibility of being able to draft the questionnaire. Today is its launch day. We mentioned it already, and we have received the formal approval to disseminate it all over European countries. WHO Euro countries, these are the 53 countries where the questionnaire will be replied to, which means that we're going to have representative information of a very extensive region. We will be receiving information from different healthcare systems about different needs and requirements, about different societies that are going to give us a very clear idea of what the state of the art is when it comes to stigma in the healthcare sector. It is going to be essentially targeted to adults working in healthcare systems. It's going to be anonymous and confidential, and it won't take very long to complete. We're going to compile basic information: age, gender, defining the person who's replying, country of residence, country of birth, and information about their work in the healthcare sector. We will also be asking whether they have been educated or trained in different aspects that are related somehow in the quality of care, and focus on stigma and comprehensive respect for the individual. I'm going to give you an example. But there will be statements, general statements like these. If the person who's replying knows that having a non-detectable viral load is a symptom of non-transmission during intercourse, and many other things that you'll be able to see here. We're also going to talk about potential prejudices, and there will be comments, therefore, about whether touching the clothing of the patient living with HIV or a wound or drawing blood for a patient is a concern for the replier. Whether it is very worried, not worried, or absolutely not worried. Another section will cover personal attitudes. And if it is for a reason that is inherent to the individual, because they are forced by the service they're working in, they have to wear gloves, or some sort of precautionary measure has to be implemented. Today, we're going to disseminate the survey reviews of the ECDC and with all the means that we'll have available, like social media, letters addressed to professional physician societies, professional nursing society of our healthcare workers. We'll do so at conferences and meetings, and we're even going to do it by word of mouth and use as many ways possible that may come to mind and that will be allowed to disseminate, as I've said before, the survey to ensure that it will be replied to by many people that are representative of each one of the levels we're targeting and from the different countries we want to receive information from. Of course, the presentation of the survey is the result of work that has taken quite a few months to develop. It first of all has to be designed. Contents have had to be designed. Then we've had to know how to phrase the questions. We've had to think about how to disseminate it in the different countries. We've also felt how it could be improved and obtain ethical response to the reply to the survey and disseminate it. By means of conclusions, I'd like to say that this is a project, and I'm proud to say this, and I will never be able to express my full-hearted gratitude to my colleagues of the EACS and how grateful we are to the ECDC. There should be long-lasting relationships like this in the future. If this is going to be also the first time European-wide comprehensive data on stigma and discrimination among the healthcare centre and PLHIV. And working in this area, there will also be situations that we're going to have to improve. We're going to be detect areas where improvement has to be done, and will provide us with substantial knowledge to design future projects on the topic. There is no doubt it's also going to allow us to create a network that will be useful for additional purposes to further promote healthcare for persons with HIV across the WHO European Union. Oh dear, I don't know what this is on screen. But I can tell you this, I would like to thank Mary Anastasia Faris on the name of ECDC and all their colleagues whom I've had the wonderful opportunity of meeting personally and face-to-face at this meeting. I would also like to thank Ana Mendez Lopez, a Spaniard compatriot that has provided us with the spirit to ensure that the questionnaire could come to see the light. My colleagues at the EACS and governing, Ella, Jasmine, and the representatives of all the countries attending, and finally Julia de Lama. This is a story that goes back a long way in time, and it is materialized finally with this high-level meeting, but also for how much sensitivity that has been invested and the hard work that Julia has contributed to this event. Thank you.
Thank you very much, dear Esteban, and we are looking forward to the result of this survey. And I'm sure that we will find time to present and analyze and discuss the results here.
And to put in practice.
Absolutely. And now it is my great pleasure to invite to this podium and to present Dr. Meg Doherty, Director of the Department of Global HIV, Hepatitis, Sexually Transmitted Infections at WHO headquarters. And she is leading a very great team of my colleagues who are leading this global, role in HIV response. Meg, the floor is yours.
Okay. Thank you very much, and all protocols observed. I really appreciate the honor of being here on the podium with so many people who are really leaders in the fight against HIV and AIDS. And I have to say, I'm hoping today that the slides are going to work for those of you who were there yesterday. It was a bit of a snafu. But I also have to thank my colleagues in the European office and also Rob this morning, who made really fantastic interventions and has been organizing this in partnership, I think, with ECDC and EACS. And I'm very inspired by, the energy in this room, how we need to take that forward after these meetings. So I hope this is just the start of a discussion. And I think a lot of what I'd like to say about addressing HIV and stigma and discrimination in the healthcare settings may have been said, or maybe a repetition, but what I'd like to focus on is what's next, what is WHO working on? This is not a new problem, and as you know this, over 25 years this has been discussed. And the fact that others have said, well, we're 20, 40 years later, why is this still a problem? And I think it's because perhaps we don't have all the people around the table who needs to be around the table to help us change ideas, but it's about society, politics, and we're in a constantly changing environment that way, and so we have to look at new ways to make communication work for ourselves. And as we get to the back end of this presentation, I'll compare what we did with Mpox, which is also very critically difficult to address, but we used different tools perhaps than we've used in the past, or we built upon what we've done with HIV and then maybe took a bit from the COVID experience to reach more people. So we know that everything around stigma discrimination, you've heard, limits us at every step, from testing, from uptake of prevention, from continuing treatment, and now what we're seeing, I don't know if it's recent data out of the UK, where there are more people who are out of treatment than who need to be identified for accessing treatment, meaning it's also about how does one maintain being engaged in care for oneself if there's, it's a challenge over a person's lifetime, and can reduce to many other marginalization, reduction in employment, education. And we have good practices, but clearly we haven't taken these to scale, and there's still a major barrier. So this is a bit of a schema or a theory of change of how do we get to our targets that we're all aiming towards, which is ending AIDS as a public health threat, or the SDG target. And just to mention, and I think Rob made a very good argument this morning, going into the UN General Assembly next week, we're off target for the SDGs. Out-of-pocket payment has increased. We also know that the coverage of service delivery has stabilized. So we need to do a lot more in the next 7 years. So this is the time where we need our energy. It's not the time to relax. And some of these actionable drivers at the front end of leading to the end of AIDS are, you've already mentioned, fear of transmission. So it's among people, but it's also among healthcare workers. They may not understand about U equals U and what is transmission risks like. Awareness of stigma. If healthcare providers are not trained, do not have access in their medical or nursing or whatever auxiliary healthcare training, they may not be as aware. Attitudes can be changed, but that needs some work and training. And we know that institutional environments are the hardest to change. And those are the kinds of things we need our government and government leaders who, for example, here were so strong. And there are some tools that have been out there and approaches, provision of information, and these seems like no-brainers, and I know it's happening. Provision of information, skills building, participatory learning, empowerment approaches, contacting stigmatized groups, and structural policies. And some of this has been tried to be put into practice in healthcare settings. An example from the lower right is from 3 countries, I think it's Ghana, Tanzania, and perhaps Malawi, where you do this work across the entire facility. So from the formative capacity building, but then addressing it at every place. So it's not just about HIV, stigma, and discrimination reduction. It's about writ large. There are many other infections that actually have a lot of stigma and discrimination. When we think about STIs or TB, we're still in problematic places there as well. Or one could bring it into the health qual or the quality improvement approaches. And here's some data that shows if you bring that in, then it's measurable, standardized measures. Have you achieved X or Y? Are you getting some sort of feedback and or compensation of doing the right thing? And certainly community engagement needs to be at the core of all of this in designing these approaches. And we have the tools, you've heard about them. We have the targets from all of the different strategies, the 10-10-10 targets out of UNAIDS you heard about as well. But I think the other thing that we need to look at, where can we bring that stigma and discrimination into other strategies? NCDs needs it in their strategy. Universal health coverage needs it in their strategy, because once it's sort of normalized as a challenge, we will maybe get greater buy-in. Already in our strategies that address HIV, hepatitis, and STIs, we actually have set some milestones that are integrated milestones. And I think that's something that ministries and others could take forward and think about approaches. Because if it's just HIV and AIDS, maybe there'll be some who will want to step away from there. But if you talk about other issues that are important, stigmatization for hypertension, stigmatization for obesity, diabetes, all of those should be addressed very similarly. In our strategies, the one thing just to highlight is we do have actions and we have milestones and we have targets. This strategy at the global level is further replicated and was presented in the slides that Rob showed for the region. So you can pull those out, and they mirror the UNAIDS strategy. I think we're all harmonized around these. But then I think it's about the government to hold, and the ministries to hold your services accountable. Then there's tools, and WHO is now working a bit more I guess, thoughtfully about how we do integration or convergence. And we have key population guidelines across 3 areas: HIV, viral hepatitis, and STIs. Stigma discrimination has a whole chapter there. We have integrated data services, integrated mental health services. And I think an example that we want to highlight is with the MPOX. We really had the emergency teams with our team working on what is stigmatizing language. How do we put out a lexicon of language that should not be used? Because in emergencies, despite our best efforts, they were using languages that were perhaps going to further stigmatize people living and having MPOX. And I think with things like this on the line, more people knowing about it, and we have to thank our ECDC colleagues and others who really took a forward stance in all of that work. And what I also, having been engaged in the MPOX response, we worked with communities effectively, and I think there was a lot of work done online, because we know young people right now. I have a teenager. They don't listen to you. They're constantly listening and flipping and looking. And I think using the social media, understanding and listening what's happening on social media, I think we have to do more of that in the healthcare, because we assume people are listening to us when we talk to them, or we assume they read the products that we put out. And perhaps young people are not. They are listening to social media influencers. My son comes back to me with all sorts of ways to solve the world's problems, including health problems. I was like, can you please go look that up in a journal and tell me where you got that information? So how are we flooding or putting the right information into social media? We may not spend enough time there, and perhaps we need to do more of that. And MPOX and the people in the community in MPOX, and I shout out to Alex Gardner there, they did that. They helped the healthcare workers do that work that we were not very good at doing. Lastly, the U equals U message. I think, WHO has been saying it, as has UNAIDS, for years. But it took us to do a systematic review, show exactly what the transmission risks are, outline it again very explicitly for now it to be really coming forward on a hashtag, say zero or zero risk. And I think those are the kinds of things we learned, that perhaps saying it is not enough, that we need to be able to put it out, systematic review the science, answer all these questions, and perhaps we need to do more of that when we interrogate the data that comes back from the Earth survey. Lastly, there is community participation engagement tools that we have at WHO, if you haven't seen those. I would have to say, finally, our websites are now much more easily you can find things on the WHO website, whereas when I first started, you couldn't. So please look at the websites. And lastly, what is the role of WHO? Sometimes, I know it's hard to end here, but we're coming into high-level meetings. The DG Tedros is in his second term. We are about norms and standards and leadership, but also three-level, making anything that comes out of headquarters or regions implementable and actionable at country level. So I think that's the important piece, that we only are as good as our advocates in country. And as we go into these high-level meetings next week, and as we think about the DG's second term, there's going to be a lot more about health promotion, about where we are in the context of the crises of migration. So issues of stigma and discrimination are going to be elevated and more important than ever. So lastly, you heard about the global partnership. Just to say, WHO is leading on the healthcare setting work streams. And this year, our colleagues, Antons and others, are putting together a new policy brief, not to reinvent the wheel, I hope, but really to bring together what are some of the best practices so that we can take a step change in stigma and discrimination in the healthcare setting. So with that, I'd like to say thank you very much for having us up here, and back to you.
Okay, I'd like to thank our two speakers, and I'd like to thank Dr. Jorge Diego, who is the Director General of Public Health in Andalusia, and also Grankov, Viatcheslav Grankov of the WHO Europe, for accompanying us in this first roundtable, this first session, in which we've addressed this such important issue, stigma and discrimination related to HIV in health and environmental sectors. We're now going to move on and continue talking about this important subject, and I'd like to introduce you to the people who will participate or will actually be responsible for moderating the next roundtable. The moderators are Dr. Taimur Nuri from the ECDC, and Dr. Teresa Campos, who is the head of the coordination service of the General Directorate of Public Health and Pharmacological Organisation in Andalusia. So I'll leave you in their capable hands, and we hope that you will enjoy the next roundtable and that you will learn a lot as well. Thank you.